the health policy as an agenda for election 2017. Article 43 of the Constitution outlines the economic and social rights. It provides that every person has the right to the highest attainable standards of health, including the right to healthcare services. Currently, the combined national and county government allocation to healthcare is approximately 7% of the total annual budget, which is low compared to the recommended 15% of the total annual budget under the Abuja Declaration. Challenges facing the healthcare sector. 1. Access to healthcare facilities. Millions of Kenyans cannot afford to pay for health services at public or private clinics. Accessibility is defined in 3 distinct components, namely non-discrimination, physical accessibility, and economic accessibility. On June 1, 2013, the Government of Kenya took action to address this problem by initiating a policy of free maternity services in all public facilities. However, implementation of this policy has been riddled with a lot of challenges, including understaffing, pressure on available medical facilities, and underfinancing. 3. Management of health facilities in Kenya. Proper management of health facilities entails applying proper management functions including planning, organizing, defining roles, creating processes and incentives, ensuring accountability, hiring and motivating staff. Research indicates that the sub-Saharan region has only 17% of its total healthcare workers employed as managers or support workers, compared to 43% in America and 33% globally. Poor management of the Kenyan healthcare sector causes an annual loss of over 5 billion shillings to the country's economy. 4. Health sector financing. The primary source of financing in the health sector in Kenya is the national government, which contributes to about 30%, while the main funder remains households at 51%. Donor funding contributes to about 16% of the total share of health financing. Compared to other sectors such as physical infrastructure and education, development partners have not invested as much in the health sector. Prioritizing health financing is a critical and essential element for economic growth and the well-being of a society. 5. Lifestyle diseases and risk health factors. In the last 5 years, the upper and middle class in Kenya have continued to increase. As a direct consequence, many engage in unhealthy eating habits which contribute to lifestyle-related diseases such as hypertension, diabetes, cardiovascular diseases, increased risk of obesity, etc. In 2015, World Health Organization estimates that 61% of all deaths were as a result of chronic diseases associated with lifestyle diseases. 6. Health sector service delivery. Health service delivery in Kenya has been faced with challenges such as financing of level 5 hospitals and communication disconnect between the healthcare workers and the counties. On several occasions, health personnel in the counties have been protesting poor and delayed salaries and promotions in some counties. Proposed solutions. Promote, develop, and harmonize policies and legislation that protect the rights of all vulnerable groups. Make sure that there is sufficient oversight and regulation in both public and private health facilities. Economic accessibility or affordability can be assured by making healthcare services related to the underlying determinants of health, that is, safe and potable drinking water, adequate sanitation facilities, affordable to all, including disadvantaged groups. On maternal health care, the government can improve the implementation of the free maternal services policy by increasing the supplies available and the number of staff.